Wow. If I had a tail right now, it would be wagging. You know, this isn't a Ken Snyder Award. It isn't a Dental Clinic Award. It isn't a St. Vincent de Paul Award. It's a community award. And it just goes to show what can happen when loving people come together in a spirit of compassion and caring. Totally amazing. And I would also like to recognize our staff. Can our staff and wonderful volunteers please stand for just a moment? Wow. Thank you so much. And as a result of their hard work and dedication and us receiving this award, I would like to announce next Thursday, our staff will be appearing on a float in the Macy's Thanksgiving Day Parade. As I said, I would like to announce that. However, Macy's hasn't called yet, so right now it looks like turkey at my house as usual, but we'll see. Here we are, almost the end of November, another Friday. Who knows what last Friday was? Does anyone know? Veterans Day, of course. Can we have all the veterans in the audience please stand for just a moment? Thank you for your service. I'm a veteran myself, band of brothers and sisters. And speaking of Veterans Day, I'd like to show you some slides of one of our patients who's been coming to the clinic for quite a few years. His name is Brando Medina. And we actually have pictures of him when he was younger than that. Cute kid, huh? Well, what's interesting about Brando is that he actually was missing 2 of his front teeth. Now, we saw him prior to this, and we took care of his cavities as he was a child. We got him into our orthodontic program. And then we got to the point where we had to do something about the 2 missing front teeth. And they just never developed. The tooth buds were never there from birth. And ours is a charity clinic, but unfortunately, we do have to cover costs of lab and materials. And Brando's case, to do it right, it was going to involve putting in some bone grafts, so those bone grafts could support implants, and on those implants we could place crowns. And the cost was going to be well over $2,000, way beyond the Medina family budget. Now, here's Brando today. I think you can see, big difference. Yeah, thank you. Now, I know what you're thinking. You're saying, first of all, where'd you get the money? And secondly, come on, Doc, what's this have to do with Veterans Day? Well, I want to read a letter from a veteran. His name is Mark Lowe. He's a decorated Vietnam War veteran. To Angelica Medina, good afternoon. It is my pleasure to make a donation toward the cost of your son Brando's important dental care. Instead of picturing the donation as coming from an anonymous person, which it did. In fact, today's the first day that they learned of his name. Please consider that indirectly the people in our community who love and care about all the Medina family are making the payment. The payment comes generously from their hearts to yours. As your life unfolds and you have the opportunities to share, whether large or small, may that sharing enrich your inner person with treasures of joy, wholeness, peace, and dignity. You may agree that sharing in that manner honors both the giver and the receiver. Best wishes, a fellow citizen on life's journey. Now, unfortunately, unlike you, Mark never got to see the completion of Brando's dental care, because about 3 months after he wrote that letter, he was diagnosed with cancer, and a few months after that, I got the call that he had passed peacefully in his home. But Mark's legacy of kindness and goodwill lives on. Please help me welcome Brando Medina. Thank you. There's the before and after, and you have a lot to smile about, not just your teeth, but you're in college now, right?
Yeah, I'm currently at Gateway Community College.
Okay, and how old were you when you first started to come to the clinic?
I believe I was 9 or 10 years old.
Okay, wow. And how many years ago was that?
8.
See, when they're young, you're allowed to ask how old you are. You get the older guests up here, you can't do that. Yeah, it's amazing what has happened. And do you think you'd like to be a dentist? I mean, you've had everything known to a dental done to you, and you probably know how to do it yourself now.
I would like to be one, but I feel like I'm very shaky, so shaking like a tree branch, and I don't want to mess up anybody's mouth.
Hey, it never stopped me. What would you like to say to the people like Mark Lowe, and you just found out his name, the gentleman, and to all the people out here in the audience who've supported the clinic all these many years?
Well, first of all, I'd like to thank all you guys for coming. I felt like I needed to do this because it was sort of like in the letter he said, it was like passing it down forward, passing the favor down. And I feel like by me coming here, I could maybe inspire someone or help someone out with probably the same problem as I did. I know I had some self-confidence issues for the same reason because of my teeth. And with this donation that Mark Lowe actually gave me, like, it really helped me out. You know, like I would hide my smile. I would be very antisocial for the same reason, like the fear of someone like seeing I had gaps in my teeth. And by him doing that, not only did he change my appearance, but he also did change my confidence as well. He boosted it up. Now I talk to more people. I'm not afraid to smile. When I take pictures, things like that. So so he really did change my life, and I like to thank the Lowe family as well for having such a good person donate.
Okay, thank you very much. Well, good luck in school, and we'll see you at the clinic, okay? Thanks so much. Yeah, take care. You know, so often at the dental clinic, people come to us that have severe medical issues that they're facing as well. And we know now that oral health is the key to overall health. And a lot of times their medical issues have kept them from pursuing good oral health, be it financially or just because of some of the ramifications of their medical issues. One such young lady is with us today. Please help me welcome Margaret Martinez. Thank you for coming. Wow, it's kind of scary being up here in front of all these people, isn't it?
Yes.
You know, I think I've been up here like 15 times and I still get scared. Years ago, I read that if you imagine yourself in your underwear, that it's supposed to help. It never seemed to work for me.
No, you're supposed to imagine them in their underwear.
You are? Where did you hear that?
From the Brady Bunch, Marsha Brady.
Well, see, I learned something today. That's terrific. So you imagine the audience in their underwear. Yeah. Oh, my goodness. Oh, my goodness. Turn this way a little bit. You look terrific. The first day I saw you at the dental clinic, you were battling cancer, and you were one sick girl, right?
Yes, I was.
Do you have more to say?
No.
Okay, no problem. And how would you say having your dental makeover has helped your overall health?
Oh, it's no wonder. It's done so much for me. They had 2 weeks to do the work, and they did it between radiation and cancer and chemo.
I'll tell you, you look terrific, and your recovery's been nothing short of miraculous. And thank you so much for coming here today, and thank you for being so brave for coming up in front of all these people. You know, so often at the clinic, we help people not only inside the mouth, but outside the mouth. 12 years ago, a young lady fresh out of high school came up the stairs to the dental clinic. She didn't have a toothache. She wasn't looking for dental care, but she was looking to volunteer and to perhaps find a career. She volunteered faithfully for 3 years, and we had an opening, and we hired her as a dental assistant. And somewhere over those next 9 years, she got the bug that she wanted to be a dentist. And she took all the courses to get into dental school, of which there are many, in the evenings and on the weekends while working full-time at St. Vincent's. She studied for the DAT, which is the Dental Aptitude Test, a very rigorous test. I know some students, if they have the wherewithal or parental support, they'll take 3 or 4 months off and do nothing but cram for it. She did it while working full-time, evenings and weekends. And I would like to announce, and this one's no joke, that she is now a freshman dental student. Please help me welcome St. Vincent's very own Betsy Leva. We are so proud. We are all so proud. You're not cutting class to be here today, are you?
Well, maybe. No, I'm not.
Okay, good. Still proud, still proud. What was going through your mind when you walked up the stairs 12 years ago?
I actually wanted to turn around and run once I saw Dr. Snyder. No, I'm just kidding. Like, no.
That happens.
No, I didn't know if this was what I wanted to do, but I'm so glad that I actually walked up the stairs and met Dr. Snyder and met all the wonderful people at St. Vincent de Paul. And then my team who is over there, if you can stand up, Betty, the assistants, Dr. Rushlow, Dr. Hurt, everybody over there, because Dr. Snyder especially, because they were the ones that actually pushed me, and there's no words to describe what he means to me.
Likewise, I'm sure. What are your plans once you graduate?
Well, I would like to kick Dr. Snyder and take over.
Well, I'll tell you what, when you graduate, come see me. I'll give you the keys. I'm going to walk down the stairs, and I think I'm going to go back to high school because they teach so many wonderful things there now that I missed out on. So thank you so much for coming. We are so proud.
Thank you so much.
You know, a few weeks ago, a visitor came through the dental clinic, and they said, wow, Ken, you know, you and the staff, all these awards, all this recognition, what do you think your legacy will be? And that word legacy bothers me. You know, we hear athletes and celebrities talk about creating their legacy. If I can win another Super Bowl or 2 more NBA championships, what that'll do for my legacy. If I can win another Oscar or an Emmy, wow, that'll be part of my legacy. I know what my legacy is going to be. One day there'll be 4 or 5 of my best friends sitting around the card table playing poker. One of them will look up and say, hey, did you hear about our good buddy Ken Snyder? No. What about that good-looking guy, Ken Snyder? The old boy passed away yesterday. He did? Whose bed is it? You see, a legacy doesn't live in the mind or in the trophy case, but it lives in the hearts and the lives of the people we've touched and the people we've helped along their way. And today you've seen just 3 of the many, many, many examples of our legacy. People like Brando, like Margaret, like Betsy. And for that, I thank you and I salute you, not only the veterans, but everyone in the audience today and those who couldn't make it. Thank you so very much. I guess that was it. The message on the slide was going to say, as always, which I always do, be true to your teeth, and they won't be false to you. Thank you so much.